Hello, my name is Noah Hamilton. This is my Nursing 641 physical assessment video. Mike has agreed to be my patient today. Just to start, when he walked in, I noticed that he was well dressed for the weather. He did change clothes for the assessment to be a little more comfortable. He had good gait, good posture, seemed to be in a good mood. Mike, I just want to ask you, do you have any questions or concerns before we begin?
Nope.
Do you need to empty your bladder before we begin?
No.
Okay. So Mike, let's start off with this. Tell me your full name.
Michael Music Goss,
Okay, can you tell me where you're at right now?
UK Hospital.
The date?
It is the 22nd of January.
Awesome. And what are you here for?
Physical examination.
Okay. And patient demonstrates that he's alert and oriented to person, place, time, and situation. Can you also tell me, just a theoretical question, if you were baking something in the oven and it was burning, what would you do?
Turn the oven off.
Perfect. So patient demonstrates good judgment and abstract reasoning. From here, I'm just going to check your vital signs. Also noted the patient's speech is clear and logical for the situation. Okay, just put this right on your tongue. Okay, temperature is 98.1. Next thing I'm going to do is just check your blood pressure. Does it matter, can I do blood pressure on my arm? Okay, awesome. Perfect. Okay, just keep that arm good and relaxed. Sorry, my hands are a little cold. Okay. Blood pressure is 124/80. Okay. Now, Mike, I'm just going to feel your pulse, and then just going to be here for just about a minute, okay? Okay. When palpating the radial pulse, I noted that it was regular, so I checked it for 30 seconds. The pulse was 31 for 30 seconds, so his pulse for the full minute was 62. Respirations, he had 7 respirations for 30 seconds, which were also regular. So multiply that by 2, 14. So now we've got the vitals out of the way. Next, Mike, I'm just going to use a little hand sanitizer here. Gloves. Okay, Mike, I'm just going to check your head and your face and your scalp. So when looking at Mike's face and his head is normal cephalic, round, face is symmetrical, No masses or lesions noted on his face. The skin is pink. And then I'm going to just check your scalp, okay? Okay. And just tell me if you have any tenderness. Okay. I don't know any masses, deformities, lesions on the scalp. The hair is well distributed, good color, clean, and no abnormalities there. Next thing I want to do is just check your sinuses on your face. I'm just going to push up above your eyes and below your eyes, and you just tell me if you have any tenderness, okay? So this is the frontal sinuses, maxillary sinuses. Any tenderness? No? Awesome. Okay, next thing I want you to do is just clench your jaw. This is the transmandibular joint that I'm checking. Now open your mouth, close it, act like you're chewing. Okay, and then can you open your mouth and slide your jaw side to side? Awesome, great. So I did not know any warmth, no tenderness, correct? No crepitus, no popping or locking in the TMJ. From here, I just want you to smile for me real big, frown, furrow your brow, raise your eyebrows. Awesome. Okay. Based off of that assessment, the patient's 7th cranial nerve, the facial nerve is intact. From here, Mike, I just want you to grab a Q-tip. Okay. So what I'm going to have you do is just close your eyes and you're going to tell me sharp or dull. So this is sharp. This is dull. You ready? Okay. Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Awesome. Okay. Based off of that assessment, the patient's 5th cranial nerve, the trigeminal nerve, is intact. Mike, now I'm just going to take a look at your eyes. So just bear with me, just look straight ahead. I note that the sclera are white. Just going to pull your eyelids down here. The conjunctiva are pink and translucent, no extra discharge, no watering noted. Okay, Mike, what I want you to do, I'm going to shine a bright light in your eyes. I'm just looking for your pupillary response. Just look straight ahead. It's going to be a little bright. The light's already dim. Okay, and then the other. One more time on this side. Awesome. Okay, pupillary response is present. The pupils are equal and reactive and round at about a 4 millimeter. There is direct and consensual response bilaterally. Next thing I'm going to do while we're shining lights on their eyes is I'm going to check your pupils. I'm going to elicit a red reflex. So just look straight ahead. I'm going to take my right eye to your right eye. Okay? Take my left eye to your left eye. Awesome. Okay. Red reflex is present bilaterally. Okay, so Mike, next thing I want you to do is just look at my finger, look at the wall, and then back at my finger. Okay. Accommodation is also present bilaterally. So Mike, I want you to look at my finger. Without moving your head, follow my finger. Okay. Patient's 3rd, 4th, and 6th cranial nerves are intact based off of the 6 cardinal gazes. That is the trochlear, oculomotor for the 3rd, trochlear for the 4th, abducens for the 6th. Okay, Mike, next thing I'm going to have you do is I want you to cover your right eye and tell me when you see my hand, okay?
Now. Now. Now.
Okay. Now I want you to cover your other eye and tell me when you see my hand.
Now. Now. Now.
So the patient's second cranial nerve, the optic nerve, is also intact. From here, I'm just going to check your nose. So looking at the nose, it is well aligned, symmetrical. The skin is pink, no lesions on the nose. Mike, can you take your thumb and cover one nostril and sniff? Okay, now do the other side. Okay, and then do both. Awesome, great. So sniff test is good, both nares are patent. Next thing I want to do is I'm just going to look up in your nostrils. I'm going to have you tilt your head back a little bit. Okay, when looking in the nostrils, I note that the mucosa is pink, moist, no lesions, no deformations. The turbinates are the same color as the mucosa, and the septum is relatively straight, no deviations. One thing I'm going to have you do now, Mike, is I want you to hold this card, and I want you to read the furthest line down you can read, the 20/20 line. One eye covered.
428739.
Okay, and then the next one.
428739.
And then both eyes at the same time.
428739.
Awesome. So the patient's vision is 20/20. He did hold the Rosenbaum card 12 to 14 inches away from the face. Okay, from here, Mike, I'm just going to check your ears. Looking at the ears, they are good size, equal in size, symmetrical. The skin is pink. There are no masses or lesions. I'm just going to feel your pinna, mastoid, tragus. Same on the other side, pinna, mastoid, tragus. Any tenderness? Perfect. Okay. Now I'm going to look into your ears. Make sure it doesn't fall. So what I'm going to have to do is put my hand on your face here. I'm going to pull the pinna up and back. Insert the speculum. Looking in. Okay. And the other side here. Hand on your face again. Making sure I point the speculum in the ear and slightly angled towards the nose. When looking at the ear canal, I note that the tissue is pink, no lesions, hair in the distal third of the ear, no excess secretions. The tympanic membrane is pearly gray, the light reflex was present, and there were no perforations noted. From here, Mike, what I'm going to do is I'm going to go behind you, and I want you to cover your left ear with your hand, and then I want you to just tell me what I whisper to you, okay? All right, so
641.
Okay, cover your other ear, and then tell me again. So
738.
awesome. So hearing is intact. Next thing I want you to do is just tell me if you hear this equally in both ears or more in the other. So this is the Weber.
Equal.
Okay. Next thing I want you to do is just tell me when you stop hearing this, okay?
Now. Now.
Awesome. Same over here. Tell me when you stop hearing it.
Now. Now.
Awesome, great. So based off of these assessment findings, air conduction was longer than bone conduction. I can note that he passed this whisper test. His 8th cranial nerve, the vestibulocochlear or auditory nerve, is intact. One thing I forgot to do, Mike, is I want you to just take this cup, close your eyes, cover one nostril, and tell me what you smell.
Coffee.
Awesome. Okay. Now just cover the other nostril. Tell me What'd you smell?
Vanilla.
Awesome. Okay. So the patient's first cranial nerve, the olfactory nerve, is intact. Mike, so now I'm just going to, there it is. I'm just going to assess your mouth. So the lips are pink, well-defined lines, no masses or lesions noted. If you can open your mouth for me. The teeth are white, straight, all appear to be there. The gums are pink and moist, no lesions. They're well adhered to the gums. Now, while we're at it, can you stick your tongue out for me? Side to side, touch your top lip and your bottom lip. Okay, so based off of that, the patient's 9th cranial nerve, the glossopharyngeal nerve, is intact. So Mike, can you open your mouth for me again? I'm just going to insert this tongue blade, stick your tongue out, and say ah. Awesome. Okay. The tongue is pink and smooth, no lesions. The hard palate is semi-whitish. The soft palate is pinkish in color. Also, no deformities or lesions noted. The uvula is straight. The tonsils are completely fine. I did not note any abnormalities with those. So from here, I just want to have you just turn your face into my hand, okay? Turn your face into my hand. Good job. Can you shrug your shoulders? Can you move your head side to side? Okay. Patient has full range of motion in his trapezius muscles and his cervical spine. So based off of that, I know that his 11th cranial nerve, the spinal accessory nerve, is intact. I wanted to also note that when I did my test with having him stick out his tongue and say ah, that he did have intact cranial nerves, number 10, the vagus nerve, and number 12, the hypoglossal. To finish that assessment completely, I would have elicited a gag reflex. I'm not going to do that. I would have taken the tongue blade and just touched the back of his throat and made sure he had a gag. From here, I'm just going to look at your neck. The neck is, the skin is pink, no lesions or masses noted. I'm going to feel your carotids. The carotids are 2+ equal bilaterally. Now I'm just going to listen with the bell to see if I hear any breweries. Okay, no breweries noted in the carotids. Okay, I'm just going to feel on your neck here. The trachea is smooth and midline. It is not left or right of midline. Next thing I want you to do is just hold your head back and swallow. Okay, and if you can, just take this cup, take a little sip out of it, and swallow. Awesome. Okay. So the thyroid gland, did you have any tenderness when I was palpating there? Okay, so the thyroid gland is normal size, non-tender. The patient's swallow is intact. From here, I just want to check your lymph nodes. So I want to feel around on your face and on your neck, okay? Okay, so here we have preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical chains, and supraclavicular. Did you have any tenderness? Okay, all lymph nodes in those areas were non-tender and non-palpable. From here, let's see, where should we go? I'm going to have you just stand up for me. If you can, okay, and then turn around. I'm going to look at your spine and your skin on your back. I would typically, have the patient remove his shirt, look at the skin. The skin is pink, no lesions noted. No masses, no deformities. Okay, I'm just going to fill the spinous processes. Okay, and then the paravertebral muscles in between. Okay, no spasms noted, no deformities that I could feel. Next thing I want you to do, Mike, is just take a deep breath in. Okay, patient has good thoracic expansion. The AP diameter is 1 to 2. Okay, next thing I'm going to do, Mike, is I'm just going to sit here and just tap on your back. I'm just going to percuss 10 areas. I noted resonance over all lung fields. While I'm sitting here hitting on you, just tell me if you have any tenderness, okay? You're going to feel just a small jab, okay? Anything? Anything? Okay, so CVA tenderness is negative. Next thing I want to do is I'm going to listen to those 10 lung fields. So just take a deep breath in. Okay. Deep breath. Deep breath. Deep breath. Great. Deep breath. Jump. Deep breath. Awesome. Great job. So Mike, you can sit back down. And then I'm going to just look at your chest. First of all, I would, of course, still have the patient's shirt off. I'm looking at the skin. The skin is pink, no lesions noted, no masses, no bulges, no retractions noted. The patient's breathing is effortless and rhythmic. From here, Mike, I'm just going to fill in your chest for the PMI. That is the 5th intercostal space, left mid-clavicular line. Just going to find that. This is also the mitral valve. Okay, filling the precordium. No lifts, heaves, or thrills noted. And I'm just going to listen to the mitral valve. After listening for 1 minute to the PMI or the mitral valve, know that the patient's apical heart rate was 72. Next thing I'm going to do is I'm going to listen to the other valves of the heart. I'm going to start with the aortic valve, which is the 2nd intercostal space, right sternal border. Then I'm going to listen to the pulmonic valve, which is the 2nd intercostal space, left sternal border. And then the Erb's point, which is the 3rd intercostal space, left sternal border. and the tricuspid valve, which is the fourth intercostal space, left sternal border. Okay. I did not hear any abnormal sounds there. Also noted when I was listening to the PMI, I heard S1 and S2 sounds. There were no S3, S4 gallops or murmurs. From here, I'm just going to listen to your lung fields anteriorly. Okay, just breathe normal for me. Awesome. So listening to the 8 lung fields, there were no adventitious breath sounds. Everything was clear. From here, I'm just going to look at your arms. So if you can, just hold your arms straight out for me. Okay, great. The skin, both arms, is pink, warm to the touch. No lesions or masses noted. If you can, just spread your fingers out. Cap refill is less than 3 seconds bilaterally. Can I see your thumbs? Great. And then bring your thumbs together. Awesome. Okay, the nail angle is fine. There's no clubbing. Camera might be turned a little around. Just going to straighten the camera out here. Okay. Tape. Yeah, probably a little more tape. All right, back to the arms and hands. So did cap refill. I'm going to just feel your pulses, radial pulses. Okay, radial pulses 2+ equal bilaterally. Brachial pulses 2+ equal bilaterally. Okay, so if you can, squeeze my fingers for me. Okay, now hands straight out. Open your fingers. Awesome. Just going to feel any pain. Okay, no crepitus noted, no non-tender. Patient has full range of motion of hands, wrists, and fingers. Can you hold your hands out? Hands up, hands down, turn them over, back over, inward, outward. Awesome. Okay, now hold your arms straight out for me. There you go. I want you to pull up, push back, arms out to your side, lift up, lift down. Okay, great. Patient also has full range of motion, like I said, in the wrists, elbows, and shoulders. We already discussed the fingers. I'm going to check your lymph nodes in your arms. Okay, so first is central, lateral, pectoral, subscapular, infraclavicular. Same on the other side. Check these. Lateral, pectoral, infraclavicular, subscapular. Any tenderness? Okay. All lymph nodes there were non-tender, non-palpable. So what I want you to do next is hold out your hands for me, close your eyes, and I want you to tell me what I put in your hand, okay?
Coin.
Okay, and then keep your eyes closed and tell me what I put in your other hand. Great. Okay, so patient demonstrates stereonosis and graphesthesia. Keep your eyes closed for me. Actually, that was just stereonosis. This is the next one. This is graphesthesia. I want you to tell me what I write in your hand, okay?
M.
Yes.
N.
Perfect. Awesome. So graphesthesia is present. Okay, if you can, just keep your hands out there for me. I'm going to put this on your hands and you tell me if you feel this, okay? And you can open your eyes. Feel that?
Yep.
Feel that?
Yep.
Feel that?
Yep.
There?
Mm-hmm.
Okay, vibratory senses are intact. Next thing I'm going to run through is kind of similar to what we did earlier. I want you to tell me if you feel sharp or dull, okay? Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Okay, so patient's pain sensations are intact. If you can, just take your finger, touch your nose, and then touch my finger. Okay, and let's do the other hand. So take your other finger, yeah, nose, finger. Awesome. Okay, so no ataxia present. From here, we're going to move on to the abdomen. If you can, just carefully lay back. Okay, I'm going to grab this blanket out from under your feet, cover you up here. Awesome. Pull this down right here. I'm going to lift your shirt up. Okay. And can you bend your knees just a little bit? Is that comfortable? Okay, sure. Awesome. So when looking at the abdomen, I note that the skin is pink, no lesions noted, no pulsations, no extra movements besides with breathing. Sorry, just 1 second. I'm going to check the camera again. Keeps kind of moving a little bit. So like I said, that looks all good. Next thing I want to do after inspecting, can you just lift your head for me? Okay, no hernias noted. Okay, now I'm just going to listen to your abdomen, okay? All 4 quadrants. Might be a little cold. Bowel sounds active in all 4 quadrants. I'm now going to listen to the aorta, the renal arteries, and the femoral arteries with the bell. Okay. No bruits noted in any of those arteries. Next, I'm just going to palpate your femoral arteries. Okay, 2+ equal bilaterally. I'm just going to feel your aorta. No thrill noted in the aorta. Now I'm just going to palpate the rest of your abdomen, okay? Just light palpation first. Any tenderness? No? Okay, I'm going to press in and then release, and you tell me if you have any pain, okay? No pain? Okay, so no rebound tenderness. Now deep palpation for masses. Okay, no masses noted. And then can you take a deep breath in for me and just hold it for just a second? Okay, you can let it out. So I can feel the lower liver sternal border, which is just about 2 centimeters worth. Let's see. I believe we are done with the abdomen. If you can sit back up. Missed anything? Actually, you can go ahead and stay laying. I'm just going to uncover your legs here. You can bring your legs straight out. Yep, just straight out there. Perfect. Looking on the skin of the legs, I noticed that they are pink, no lesions, no deformities. They are symmetrical. I don't notice any varicosities. Just going to feel your dorsalis pedal pulses, 2+ equal bilaterally. Posterior tibialis pulses, 2+ equal bilaterally. The skin is cool, but the room is a little cool as well. So, checking cap refill, less than 3 seconds bilaterally. Can you move your toes for me? Okay. Any pain, tenderness? Okay. Move your foot a little bit for me. Okay. I don't note any edema on the lower extremities. There was no crepitus, no popping in the joints of the toes and the feet and the ankles. While you're here, can you take your right heel and slide it up and down your left shin? Okay, and then do the same with your opposite foot. Okay, perfect. No ataxia noted in the lower extremities. Next thing I want to do is I'm going to have you tell me sharp or dull, okay? This is sharp, this is dull. Ready? Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Awesome, great job. Pain sensation is intact in the lower extremities. Next thing I want to do is vibratory sensations in the lower extremities. Can you feel that?
Yeah.
Can you feel that?
Yeah.
Feel that?
Mm-hmm.
And that?
Mm-hmm.
Okay, vibratory senses are intact in the lower extremities. All right, can you raise your leg? Can you lower it? Raise it against my hand, lower it against my hand. Can you turn your legs out, in, and then take your leg out to the side and back in, and then your other leg out to the side and back in. Awesome, great. So now what I'm gonna have you do is if you can sit up on the side of the table again. All right, perfect. From here, I'm just going to check some reflexes. Let's just start with your arm since you're sitting back up. So just let this arm go nice and loose. So the brachioradialis, okay, biceps, perfect, triceps, perfect. Same on the other side, nice and loose, brachioradialis, perfect, biceps, triceps. Awesome. So brachioradialis, bicep, and triceps reflexes are intact. Next thing I want to do is check the patellar and the Achilles reflexes. So, perfect. Awesome. Now just check your Achilles. Just let that foot, there you go. Okay. Same over here. Perfect. Awesome. Okay, so the patellar and Achilles reflexes are also intact. Okay, if you can now for me, just stand back up. Stand nice and straight. Okay, put your feet together and your hands at your side. And then close your eyes. Okay, perfect. So a patient has a negative Romberg test. Can you walk heel to toe for me, straight ahead? And then turn around and come back. Great job. Patient has good gait, no issues there. When looking at his posture, the patient has good posture. Shoulders and iliac crests are symmetrical. Can you lean back for me? There you go, and then straight back up. And then can you, yep, and just let your hands dangle. Just feel your spine. Okay, and then you can straighten back up. No scoliosis noted, no kyphosis or lordosis as well. Can you touch your ear to your shoulder and then on the other side? And then Raise your shoulders now against mouth. There you go, and then bring it back down. And can you look to the left and right? All right, the trapezius and muscle and the shoulder muscles are grade 5 strength, full range of motion. The cervical spine is grade 5 strength, full motion, and then the rest of the spine is also has good movement, good range of motion. From here, if you don't mind, I'm gonna have you sit down one more time. And we'll check the bottom of your feet. This might tickle a little bit, okay? Okay, sorry about that. Might tickle, okay. So Babinski reflex is negative, the plantar reflex is positive. From here, if this were a female patient, I would do I would ask the patient if they would be okay with me doing a breast exam. With the breast exam, I would first have the patient take their shirt off. I would note the skin color, the symmetry of the breasts. I would note the color of the nipples, any abnormalities there. After I visualize the breasts, then I'm going to palpate, and I would start outside and work in a small circular motion inward towards the nipple, feeling for any lumps, bumps, or lesions. Also noting if there are any palpable lymph nodes or pain, tenderness to touch. Then for the breast self-exam, I would tell the patient when at home, once a month in the shower in front of a mirror to, and after their period, to make sure that they look at their breasts, make sure there's no abnormalities, no changes in skin color, no new lesions. I would also tell them to work in a small circular motion from the outer part of the breast to the middle part, to the nipple. And if they found anything abnormal, I would let them know that they need to go to their healthcare provider and get a checkup. And I would also check the patient's breasts while they were standing with their hands at their side, hands on their hips, and hands behind their head. I would check them while they were lying down with a pillow under the side that I am checking. Also, I'm not going to perform this, the testicular self-exam or the testicular exam. I would note the distribution of hair around the penis and scrotum. I would note if there were any lesions or masses or deformations. I would note if there were any odd temperatures, discoloration. When checking the testes, the epididymis, and the vas deferens, I would have each testicle between thumb and forefinger and gently roll them around, feeling for any masses or any abnormal tenderness. Do that bilaterally. I would tell the patient at home to do their own testicular self-exam in front of the mirror. I would have them have each testicle just as we would have performed it between the thumb and the forefinger, and then roll the testicle gently around to feel if there's any masses on either one, and do that once a month in the shower. Also, I would note that the positioning of the urethral meatus and that there was no discharge. From here, if you can, just stand up for me one more time. Okay, can you raise one foot, stand on one foot, and then other foot as well? Awesome. Okay, so the patient's cerebellar function is intact. I believe that is everything. So this concludes the physical assessment for Mike Goss.